Hello, this is Dr. Clark, and this is Chapter 1, a brief history of veterinary pharmacology. So, we're going to discuss some of the history of pharmacology today. We're going to go over some of the different laws and acts that go along with it. Some of this goes along with the slides, some of it you'll just have to take notes and listen to because the slides don't quite cover everything. And then there's some definite terminology we're going to use. So, kind of a history of pharmacology. Pharmacology has been around for thousands of years. We know this from records from Babylon. We know this from records from Egypt. And so most of our drugs have actually come from plant sources. They came from herbal sources, or they came from animals, or they might have come from funguses. So there's all types of different things that we actually find out in nature. And so people have been using this for years medicinally. Veterinary pharmacology kind of comes into its own in the early 1700s, and modern pharmacology as we know it comes in the early 1700s. Pharmacology has its roots in alchemy, which was actually studying of trying to turn different substances into gold. So like trying to make a rock into gold or lead into gold. People thought you could do that. And this is the early roots of chemistry. And so chemistry kind of gives rise to apothecary. And so apothecary is actually making drugs. So all these different things we did chemically and these things we were learning chemically, we learned how to actually quantitate them scientifically and actually start taking these herbs and trying to use them in different ways. And so in some countries, like in Great Britain, they don't call it going to the pharmacist. They still say you're going to the apothecary. But here we call it pharmacology. In the about mid 1760s, over in France, they actually started to break medicine off from human to veterinary. And so before this, your physician that came out and delivered your baby was the same doctor you called to come deliver a colt or a filly or a bull calf or a heifer calf or even puppies. Or they might have lanced a boil on you and then turned around and lanced a boil on the cow. And so starting in 1760, there's actually the split, and it starts in France, between veterinary medicine and human medicine. And this goes on in the 1790s that a lot of European countries in the 1790s actually make that split. In the United States, we made that split starting about 1840. In 1840, Iowa State University was established. It's one of the first veterinary schools in the country. It's the oldest in the country today. And really, veterinary medicine became separate starting in about the 1850s. You really start seeing a large establishment of different veterinary schools across the country starting then. With this split off from human medicine with veterinary medicine, we actually started getting veterinary pharmacology. We were starting to actually use drugs for animal purposes. And so veterinary pharmacology is relatively new when you look at pharmacology overall. In the thousands of years we know we've been doing pharmacology for 5,000 years in records. We're only looking at probably about 200 years that we've been doing it in veterinary medicine. There's not that much difference except for the fact that we're looking specifically at animals. When you're looking at pharmacology, you're actually studying physical and chemical characteristics of materials, and you're actually looking physically at how you can use these. Does it have to be oral? Can it be injectable? And then chemically, what's it look like and how's it actually going to interact in the body? And this is known as materia medica when we do this. And so we actually find a lot of our things out in nature, and we actually extract a lot of our drugs from some of these different sources I talked about. A lot of them largely plants. Some of them, like a lot of our antibiotics, actually have roots with funguses. Some of them can be bacteria. Some of them are animal sourced. And so we'll actually take these, and nowadays, instead of using natural substances, we actually sit there and we actually make a lot of these synthetically. And that way we're able to mass produce them and help to keep purity standards. When we look at terminology, pharmaco means drugs. So pharmacology, ology means study. So pharmacology is drug study or the study of drugs. Pharmacotherapy, therapy means to treat, so pharmacotherapy is using drugs to treat something. Kinetics is the most movement, so like if you took physics, kinetics is how things move. So when we look at pharmacokinetics, we're actually looking at how a drug is absorbed by the body if it goes orally, or of course if you inject it, it goes straight in. So you're trying to figure out how much of the drug can you actually get in the body. What are the blood levels and what do they peak at? Where does it go to in the body? So does it go to one organ or does it go all over the place? Is it absorbed absorbed in the fat, or does it stay away from the fat? How's it metabolized? How's it broken down? And then how's it removed from the body? Is it removed through feces? Is it removed through urine? Is it removed from a combination of those? So we're looking at all those things in kinetics. We're looking at motion, how the drug comes in, where it goes to in the body, and then how it leaves. Therapeutics is actually the study of using drugs for treatment. So veterinary pharmacotherapeutics is the study of veterinary drugs in their therapies with animals. So you're actually looking at how do these drugs actually affect the illness of these sick animals, and how does it make an improvement or does not make an improvement? And so the drugs that we have should be making an improvement, and so we're actually studying how does it improve it and how does it actually do that. Dynamics, some people get this confused with pharmacokinetics, but dynamics is a little bit different. Kinetics, we're looking at the motion through the body. Dynamics, we're looking at the interaction. So we're actually looking at how does this drug interact in the body, and then chemically, is there other things that it interacts with? So how does it actually interact with another drug? So if you were to give penicillin, how does penicillin act with in the presence of aspirin, let's say? And so that would be pharmacodynamics. We're actually looking at how those two work. And then penicillin, how does it actually get along in the body? So we're not looking at the motion as much as, how does it actually attach and work to itself in the cell? So how's it interacting with the body? How's it interacting with the bacteria? So once again, for penicillin, we know that penicillin actually works by attacking the cell walls around bacteria, and so that's the study of dynamics. We're seeing, so what is it actually doing? So kinetics is motion, dynamics is the interactions. How is it actually interacting and how is it doing its job? So we're actually getting into regulations of products, and there's quite a few laws that go along with this. And the very first one is where it all starts off at is with the Food and Drug Administration. Became an agency underneath the Federal Pure Food Drug Act of 1906. And so this was actually driven by a book that was actually based more on socialism, but it ended up inspiring a law to try to clean up the food industry. And along with that, they had noticed that there was also a problem with purity with drugs at the time. And so a lot of people read this book, and The Jungle was about working at a slaughterhouse and meat processing facility in Chicago, and about all the injuries and the bad things that happened to the workers, and things like they would lose their hand and it would get like ground up in a meat grinder, but nobody would pull that out, and they would just go ahead and sell the meat that way. And stuff like this actually did happen, and about the number of rats that they had in there and all these different health issues. And so President Theodore Roosevelt read it, and he and some people in Congress got together and went and pushed through this law. And basically what it said is, on the food side, is it set standard regulations for the way that food should be processed, handled, and its safety to try to reduce illness and to have some sanitation there. On the drug side, and this is what we're going to be looking at, is it established some basic standards, and it's the first law of its type in the world. So it said that drugs actually had to list the strength. So like how many milligrams per tablet, or how many milligrams per milliliter. Purity, was it, how pure was it? This is where you get like 99% pure or 98% pure from, is actually this law. And then they actually put a guideline for labeling drugs. And before this, there was no guideline for drug labeling. So it established some of this stuff as a baseline. It's not on the slide, but in 1914, there's a very important act called the Harrison Narcotics Act. And so at this time in 1914, anybody could get opiums or cocaine or anything like this. And it established how much of these drugs you could actually get before you needed a prescription. And then it actually put regulations on, if you got a prescription, how the pharmacists or how the physicians or how the veterinarians were supposed to record that prescription and the amount that you got over the amount that was allowed to be bought over the counter. In 1933, the FDA got the law for the Pure Food and Drug Act strengthened. And so what this actually did is before this, there was a law that said, okay, the FDA is over strength, purity, and guidelines for labeling. But they really didn't have much enforcement as far as doing fines or penalties. They could tell somebody, hey, you don't have this right, go fix it. But if they didn't really have a way to go enforce that. And so in 1933, that part of the law was actually strengthened. In 1938, Congress passes a new law, which is known as the Food, Drug, and Cosmetic Act of 1938, which actually started testing. So this actually required testing of drugs to demonstrate safety. Before this, you could come out with any drug, and as long as you had strength, purity, and guidelines that were within the labeling standards, you could have any drug out there. And you didn't have to actually prove its safety. So in 38, they came along with a law that says, okay, you actually have to demonstrate that these drugs that you're proposing to sell are going to be safe. And so we'll get into more of that in Chapter 2, but this law is what establishes all those safety records. And once again, it was the first in the world like it. And then, as you go forward in time, in 1968, there's what they call the Animal Drug Amendments, and it's actually over here on the next slide, so I'll go to it, then we'll flip back. But this is actually an amendment on top of the Food, Drug, and Cosmetic Act. And so basically what this one right here says is that it put regulations on new animal drugs underneath here to make sure that the animal drugs and medicated feeds were being used properly. And part of it was to actually make sure that there was going to be specific withdrawal time periods listed on there and detection methods for residues, especially for food animals. So before 1968, there wasn't really anything that said that you had to withdraw animals off of drugs or really test animals for drugs in the food chain. Once again, this is one of the first laws of its type in the world, if not the first. And so in 68, with food animals, we actually established, okay, so if you're going to give this drug, how long can you give it for? How long do you have to withdraw it from? If it's labeled for food animals, all that has to be in the label or has to be available. And then it actually set the methods to actually detect drugs within food animals. So once the animal was slaughtered, it actually made it to where there was a law saying, well, you actually have to go detect it, and this is how you're going to do that. So it actually put regulations in place for that. In 1970, a couple of slides down here, flip back up, there was actually the controlled substance, it's actually called the Comprehensive Drug Abuse Prevention and Control Act of 1970. And so what this actually does is it establishes an agency called the DEA, Drug Enforcement Agency. And so the Drug Enforcement Agency becomes important as far as regulating controlled substances and narcotics. So it's what actually replaced that 1914 Harrison Narcotic Act. So before 1970, it wasn't actually illegal to have, by the federal law, things like cocaine, marijuana and all that, opioids, morphine, as long as you were within the permissible limits of the Harrison Act. And in 1970, all that changes, and the Drug Enforcement Agency, which is a branch of the Department of Justice, is formed. And so they actually go and they start establishing schedules, and we'll get back to that as far as controlled drugs and how they're going to be regulated in their use and how they have to be recorded. In 1970, also the Environmental Protection Agency took over the role from the FDA for pesticides, establishing tolerances. So things that would be actually considered pesticide that we use in veterinary medicine are things like Frontline, Advantix, flea sprays, flea dips, and all that. All that in 1970 went underneath the control of the Environmental Protection Agency from the FDA. And it went on control on both the human and the veterinary side. A lot of times for use in animals and people, there's input from the FDA, but the actual regulators, the EPA. In 72, the FDCA was amended further, and so one of the biggest things added on here was actually over-the-counter drugs. And before 1972, there wasn't much regulation on over-the-counter drugs, and so it actually stiffened the regulations on them and made them actually have to conform to the same standards as prescription drugs as far as looking at safety, and improved a lot of the labeling standards that were on over-the-counter drugs. The other thing that happened is in 72 is the FDA was in charge of overseeing vaccination and biologic agents like plasma and serum in veterinary medicine, and that control was actually turned over to the USDA. So the USDA is the one that actually sits there and regulates things like vaccines and, let's say, plasma, like fresh frozen plasma for foals or calves that have poor immunity when they're first born, or for diseases such as botulism. So we actually have antitoxin serums for them, and plasmas that we can give for certain diseases like botulism, or West Nile virus. And so these are actually not regulated by the USDA. These biologic agents in vaccines are actually in animals regulated by the USDA. In 1984, on the human side, there was what they called the Drug Competition and Patent Term Restoration Act. And in 1988, they followed that up for us on the veterinary side with the Generic Animal Drug and Patent Term Restoration Act. So before this, there was questions about how long patents were on drugs, and some patents were short-term, some were lifetime. And so what this actually does is it actually goes, and these laws are actually pretty much the same between human and veterinary medicine. They just happen to be 4 years apart. But the 1988 Generic Animal Drug and Patent Term Restoration Act basically says that any drug that's developed by a drug company, that once it actually is approved and hits the market, that company has a 20-year exclusive right to that drug. And so it sets the patent term for it. It says 20 years after you hit the market and it's approved, you have a patent on that drug. After 20 years is up, it allows for that drug to actually move over to the generic market, and other manufacturers actually have that. And the idea behind that was to allow new drugs when they came out, for the company to be able to have that exclusivity, to encourage them to make them, to where they would continue to develop new drugs and be able to profit from them. But then after 20 years, let them go to generic, to where they would be more affordable to the general public and to veterinarians. The next big one that comes along, and it's a very huge one, is the 1994 Animal Medicinal Drug Use Clarification Act, or the AMDUCA. And so the AMDUCA ends up having to deal with, I'm trying to see about extra label use in drugs in animals. So in 1994, this law comes about, and it says that as veterinarians, that we can actually use a human drug in an animal, or we can actually use a drug that's labeled for a dog and other species. An example of this is euthanasia solution. It's only licensed for use in dogs, but we use it in all species. Before 1994, there wasn't a law saying that we could do this. There wasn't a law that said that we couldn't do it either. So the question is if there's not a law there, is it legal or is it not? And so in 1994, this AMDUCA, or Animal Medicinal Drug Use Clarification Act, came through and said, okay, yes, veterinarians can use a drug extra label. I can actually change my dosage from what the label says. I can actually use it in other species besides what's labeled, and I can use animal drugs or human drugs over in animals. One thing it did is it further strengthened extra label use in food animals, so it kind of put more regulations on using extra label use in food animals to make sure that we weren't using drugs inappropriately that would actually taint the food supply. You actually also have the Animal Drug Availability Act of 1996, which allows for a flexibility process when we actually go to get approved drugs. And so what it used to be is if you were going to approve a drug for a dog and a cat, you had to do one submission for dogs and one submission for cats. So you had to do one for each species. And so what this does is it allowed you to make a submission and put multiple species in your submission, which helped to streamline and make a more efficient process for people to get drugs from multiple species to market. In 2001, we have the Minor Use and Minor Species Health Act, which is kind of similar to what they call the Orphan Drug Act of '83, and it's intended to let the FDA authorize drugs for use in less common species or indications. So a labeled drug might be used in a minor species, and it could also be provided to a major species. So we might be using something, say, specifically for elephants to treat a disease, and it does then allow maybe that drug, if it proves to be effective in elephants, to be used in other species. And then it actually let us bring in drugs from other countries that were, say, used specifically for something like tigers that might be used over in, say, India, a drug that's over there that's been known to treat something in a zoo, we could actually bring it over here and use it in the zoo too. And so, once again, there wasn't a law saying that we could or we couldn't. And the extra label side, we definitely could. But some of the importation and some of this moving around for minor species and minor use, it kind of clarified it and actually gave veterinary medicine a much stronger standing. Something that's not going to be in the slides or in the book is something that just came out here in January 1st, 2017, became law, which is the veterinary feed directives. And so what happened is in 1990, 80% of our antibiotics were being used for therapeutic reasons, and only 20% were being used as growth promotants in feeds. 2010, those numbers had totally switched. Only 20% was being used therapeutically, and 80% was being used for growth promotants in food animals, so beef, swine, poultry. And what we were noticing on the veterinary side, and was worrisome to the human side, is we were starting to see an increase of resistant bacteria, and this is becoming a problem. So what the FDA has done is said, okay, instead of being able to just buy over the counter without a veterinarian involved, medicated feed as a growth promotant, now to get a medicated feed, you're going to have a veterinarian's prescription, and the veterinarian is going to have a therapeutic reason for that. So what it's doing is it's taking away antibiotics at very low dose that are used as growth promotants and replacing it with antibiotics that are put into feed for therapeutic reasons. And this is actually kind of a good thing, because we've noticed that in cattle, since we've really ramped up the amount of antibiotics that we've used in feed, we've also started getting more and more resistant strains of bacteria and respiratory diseases, to the point where it's like every 2 or 3 years we're having to come out with a new antibiotic because all the others are resistant. Before 1990, we really didn't have that problem. We didn't really have that many drugs, and they were very effective against our respiratory diseases. But as we started ramping up the amount of medicated feeds and antibiotics in feeds, we started noticing that we started getting a much higher rate of resistant bacteria. And so this is what this is supposed to do. Is it's supposed to be a way to make sure that we're doing things therapeutically, and we're not doing things generally as a growth promotant, and we could potentially make it to where we would develop one day strains of bacteria that no antibiotics would work on. And then we're also trying to control to make sure that what's getting into the food supply is overseen by a veterinarian, that any type of drug that's put in there is put in there properly. So these are the major laws that you need to be aware of. Going forward with things like the FDA, it's needed to be known that it's headed by commissioners. And it's organized into a number of different what they call centers. There's the head of the FDA, that's actually a political appointee by the president. But you have these different centers underneath them, and the one that we answer to is the FDA Center for Veterinary Medicine, otherwise known as the FDA CVM. And so this is the one that's got all of the oversees all the veterinary drugs. And so they make sure that they're actually safe for use in the animals. So they establish the safety standards. They do the reviews. We'll get into more of that in Chapter 2. And then they also make sure that when we use these, that if they get into the food supply, they establish the tolerated limits and what those standards are, what drugs are allowed to be used in food animals, which ones are not, what the withdrawal times are supposed to be. So they actually sit there and regulate all of that. And so they're all about making sure that it's safe and the drug is used in the safe and proper way. So we've been talking about prescription drugs. Prescription drugs have to have a label. So you have to have a prescription to get a prescription drug. There's also over-the-counter drugs. And so over-the-counter drugs can be purchased without a prescription. One thing is, to be an over-the-counter drug, they have to show very low or no significant potentials for toxicity when taken as direct. And one thing to know is to always ask your clients if they've been using any over-the-counter drugs with their animals, because they might mask underlying medical conditions, or that could potentially cause medical conditions, especially if they're using like a human over-the-counter drug in animals, certain ones you would not want to use. So prescription drugs are regulated by the FDA, and so they're limited to the use underneath the supervision or prescription of a veterinarian or a physician. And the reason why they're a prescription drug is safety-wise, is there's a potential of danger from their use. So things like your narcotics, if you overuse them, they can become addictive. There's a toxicity concern, so if you're not using them within dose, they can become toxic. Um, Administration difficulty. When we look at antibiotics, there's certain ones I know that are over the counter, but a lot of them stay prescription because we're wanting to make sure that they're being used appropriately and judiciously to where we don't start having issues with superbugs and resistant bacteria out there. Be able to do a prescription for a veterinarian, there has to be what we call a valid veterinary client-patient relationship. This means that within a year I have seen the patient's animal or herd, or the client's animal or herd, and I have agreed to take on that animal or herd and the client as my patients. And so I have to actually have this. They call it a VCPR, is the initials for it. And so this has to be established. So if somebody walks into a clinic and they want HeartGuard, which is a prescription product, but I have not actually seen them before, you cannot just give them HeartGuard. If I have seen them within the last year and I actually have a prescription in there for a refill, and they come in and they were needing more, then you can easily dispense it. And the same thing is that if I have not seen the animal, then I'm not allowed to write a prescription for it. So I actually have to have this to be able to do a prescription, and you have to have it to be able to dispense anything. Extra label drugs, we kind of talked about their being passed by law to allow this to actually happen. But extra label things can be deviating from on the drug label you're going to have the species used in. So if I use something in another species besides the one that's on the label, that's extra label drug use. There's a specific dosage or dosage range. So if I deviate from that, that's an extra label drug use. The other thing is using a human drug, and we do this quite often. We'll use human drugs in the veterinary side, but when I do that, that's actually an extra label drug use. And there's certain regulations that go along with that, and they're especially tight and stringent on food animals. Once again, we're looking at trying to keep food chain safety in place. One thing that goes along to actually help this out is something called FARAD. It stands for Food Animal Residue Avoidance Data Bank. They just have bank on here, but it's data bank. So Food Animal Residue Avoidance Data Bank. And so this place you can go to, it's a computer-based system. You can access it online at www.farad.org, so farad.org, or you can call them up at 1-888-US-FARAD. So 1-888-US-FARAD. And what they actually have is they have information in there that tells you if you can use this drug in a food animal. They have information in there if it's prohibited or which animals it's prohibited to. So there's some things that we can use in young dairy heifers, but we can't use in veal or milking dairy cattle. So it'll tell you what drugs are allowed to be used and which are not. And it will tell you what issues that you have as far as withdrawal times. So how long after you give this drug do you have to withdraw it? What are things like the tolerable allowances allowed for this drug, say in a chicken or in a cow after it's been turned into meat? They have scientific articles in there. They have pharmacokinetic studies. They have how they're metabolized and how they're removed from the body. And they also do pesticides, so things like our different sprays that we use for ticks and flies and stuff in cattle. So it's not only the drugs that we use, but also the stuff from the EPA that's the pesticides. So all these different things are actually within this data bank, and so you can easily access that information. So controlled substances, talked about that act from 1970, and so these are drugs that have deemed to have some type of issue of addiction to the body. And so we actually have 5 different schedules on this. And so the DEA is over top of controlled substances in this country. And Schedule 1 drugs are drugs that they have deemed have no therapeutic value. The only way you can get these drugs legally is for research. And it's really fun to do because they can't legally be sold in the country. So it's kind of hard to get a hold of them. So some of the drugs that actually fall in this is things like marijuana, LSD, and heroin, according to the DEA. Schedule 2 drugs have a therapeutic use, but they're the most tightly regulated. And so this is going to be most of your opioids. Actually, cocaine is actually used as labeled as a Schedule 2 also, because it can actually, there's actually a therapeutic use for it. It's actually used as a local anesthetic and actually used to stop nosebleeds in people. So cocaine and your opioids like morphine, fentanyl, your codeines, these are all Schedule 2. And so Schedule 2 have the tightest scrutiny to them. You can't call in a prescription for them. In Texas, you actually have to use a special pad provided by the Department of Public Safety, and it's actually in triplicate. I write the prescription, I keep a copy, you take it to the pharmacist, he fills it, he keeps a copy, third copy shipped to the state. When you order Schedule 2s, it's the same thing. You just can't call up your distributor and say, hey, I need morphine. You actually have to write out how much you need on a paper and triplicate, keep a copy, mail it to your distributor. They end up filling it. They take a copy of it and keep it, and they forward a copy after it's been filled and noted that it's been filled, and they send it on to the DEA. Then we have Schedules 3, 4, and 5. And so what determines the drugs in a Schedule 3, 4, or 5? I'm not sure. But the regulations on them are not as strict as far as ordering them. So I can actually call up a distributor for a Schedule 3 like ketamine and say, hey, I need ketamine, and I can do that verbally. I can also call in a prescription for something like, say we have a dog that needs something like Valium, which is a Schedule 3, yes, for like storm anxiety or something like that. I can call a pharmacist with that prescription for him. So you don't actually have to have it in writing. All of these have the same strictness as far as actually having to log them. So one of the things that will come about with controlled substances is you actually have to have a log of use. And so you actually have to record when we procure these drugs, so an invoice when they came in, when we dispense them, so when they go out, or when we use them, so like in anesthesia, and we actually have to record how much of these things come in and go out, and actually keep a balance sheet on hand of how much of the drug is there. If there's any type of discard or theft, we have to notify them in the records of that. If there's a theft, we have to let the DEA, and in Texas, we have to let DPS know that there has been a theft or diversion of our drugs. Federal law requires that all of this stuff actually be recorded and kept recorded for a period of 2 years. State of Texas law actually says 5 years. So in Texas, we keep it for 5 years. Some states will follow the federal law, which is 2 years, to keep all this written down and registered. But state law here in Texas, it is 5 years. Other thing with controlled substances is they actually have to be locked in a safe or a cabinet, and they have to be behind another door that can lock. So like here, we actually have them in our pharmacy, which we can lock the doors to the pharmacy, and then they're actually stored in a cabinet that actually has double locking on it. So we actually have a double locking cabinet on the wall. So it has to be stored and secured some way to where it's not easily stolen or taken. So lastly, before we go here, is if you look at page 11 in your book, there's actually an example of a label. And so we'll actually look over this label in lab and actually look, it's actually a control one, but we'll actually look at what some of these different things on these labels actually mean when you're actually looking at them, like your brand name, your generic, looking for controlled, strength, all these different things that you need to know.